Go-to remedy has worked for this symptom for many years, so of course you'd reach for it. But knowing what to reach for instead, and when to stop waiting, is the difference between being sick for days or weeks. Joyce had dealt with stomach bugs before. When the diarrhea started on a Tuesday, she did what she had always done. Joyce, age 74, took 2 Imodium, drank some Gatorade, and waited for it to pass. By Thursday, it was worse, not better. By the following Monday, she was back in the bathroom every hour, too weak to stand at the kitchen counter. She had lost 6 pounds in 9 days. Her daughter found her sitting on the bathroom floor at 2 in the morning, confused about what day it was. Joyce hadn't felt thirsty. She had been drinking. She didn't understand why her legs felt so heavy, or why she kept forgetting what she had just said. She had no idea that the Imodium had been working against her the entire time. What her daughter saw on that bathroom floor wasn't confusion from tiredness. It was the early sign that Joyce's body was in serious trouble. The people who never hear what I'm about to tell you keep reaching for Imodium and plain water and waiting it out. The ones who do hear it make 3 specific changes, and the outcome changes completely. It could for you, starting today. Here's why Imodium is the wrong move for this infection. Think of your gut like a conveyor belt. Imodium hits a brake on that belt and slows everything down. That's how it stops diarrhea. For a normal stomach bug, that can be helpful. But this infection is a parasite living on that belt. When you slow the belt down, you're keeping the parasite inside your body longer. Your body needs to move it out. Imodium works directly against that. Infectious disease doctors generally don't recommend anti-diarrheal medications like Imodium for confirmed or suspected parasitic infections for exactly this reason. If you're not sure what's causing your symptoms, ask your pharmacist or doctor before taking it. Now, what about Pepto-Bismol? Will that work? Many people reach for this as an alternative. If you take a blood thinner, warfarin is the most common one. Don't take Pepto-Bismol without checking with your pharmacist first. Pepto-Bismol contains compounds similar to aspirin. The FDA label for Pepto-Bismol advises talking to a doctor before using it with blood thinners. 1 call to your pharmacist takes 2 minutes. But whether it's Imodium or Pepto-Bismol, neither one deals with the real danger of this infection, dehydration. Here's what the research shows about dehydration after 70, and why it's different from when you were younger. A study published in the New England Journal of Medicine found that the thirst signal weakens with age. In adults over 70, the brain doesn't send a strong thirst signal, even when the body is already losing dangerous amounts of fluid. That means by the time you feel thirsty, you may already be in trouble. The early warning signs in seniors aren't thirst or dry mouth. They're confusion, heavier legs, and trouble remembering what you just said. Exactly what Joyce was experiencing on that bathroom floor. Plain water makes this harder, not easier. The diarrhea is pulling salt and minerals out of your body with every trip to the bathroom. Plain water replaces the liquid, but not what was lost. After enough water without enough salt, the balance tips. And that's when confusion starts. Gatorade was designed for athletes sweating during exercise. It doesn't have enough salt or the right balance for illness-level fluid loss. The WHO, the World Health Organization, developed a specific formula for exactly this situation. It has the right amount of salt, the right amount of sugar, and the right minerals to replace what diarrhea takes. In the US, you can find it at any pharmacy. Ask for Pedialyte or oral rehydration salts, not a sports drink. Pedialyte or oral rehydration salts. Pace it, though, small amounts often. A few ounces every 15 to 20 minutes. Your gut is inflamed. Large amounts at once can make nausea worse. Pedialyte or oral rehydration salts, not plain water, not Gatorade. That's what to put in your body. Now, there are 3 medications already in your cabinet that this illness changes the math on, and one of them has a specific FDA warning tied directly to the antibiotic you're about to start. First, metformin. This is a common diabetes medication. The FDA label for metformin advises pausing it during severe illness that causes dehydration. When your body is dehydrated, the kidneys slow down. Metformin can build up to unsafe levels when the kidneys slow down. If you take metformin and you're too sick to eat and drink normally, call your doctor. Ask specifically. Should I pause my metformin while I have this? Second, water pills and NSAIDs. Water pills. Furosemide is one common name, are already pulling fluid from your body. Adding a diarrheal illness on top means you're losing fluid from two directions at once. NSAIDs are pain relievers like ibuprofen and naproxen. They're hard on the kidneys when you're dehydrated. Call your doctor and ask whether to pause either one during this illness. Third, digoxin. This is a heart medication used for an irregular heartbeat or heart failure. The FDA label for the antibiotic Bactrim, which is the treatment for this infection, contains a specific warning that Bactrim can raise digoxin levels in the blood, especially in older adults. Dehydration during the illness raises digoxin levels on its own by a separate path. If you take digoxin and you develop this infection, your doctor needs to know that day, not tomorrow, that day. Those are the three things to flag with your doctor if any of them are on your list. But listen carefully here. There are signs, and if you have any of these, skip the call and seek medical attention immediately. Two of them don't feel like emergencies when they start. Managing at home is reasonable if you can keep fluids down and your symptoms are stable. Call your doctor, same day. If you have had diarrhea for more than 48 hours, if you see blood, or if you take digoxin, metformin, a water pill, or a blood thinner, tell them about this outbreak. Ask for a test and ask specifically about Bactrim. Go to the emergency room. Don't wait if you see any of the following signs: confusion or trouble remembering things you just said, legs that feel heavy or weak, standing up and feeling like you might fall, diarrhea more than 6 times in one day, no urination in 8 hours or more. These aren't signs to watch and wait on. These are signs to go now. Whether you're managing this at home, calling your doctor, or already on your way to the ER, there's one question worth bringing to any of those conversations. I may have been exposed to a waterborne parasite. Should I be tested? Is Bactrim the right treatment for me given my other medications? That one question makes sure whoever you're talking to, a nurse line, your doctor, an ER physician, actually connects what's happening to you to this outbreak instead of treating it like a generic stomach bug. So, what happened to Joyce? In the emergency room, the blood work showed her sodium was low. The diarrhea had pulled salt out of her body, and the plain fluid she drank replaced the water without replacing the salt. Her potassium was low too. The diarrhea itself had taken it, and her water pill had been pulling more every morning. She had been drinking. She hadn't been replacing what the illness was taking. The Imodium had slowed the diarrhea just enough that she thought she was managing, while the Parasite kept doing damage underneath. With IV fluids, the right electrolytes, and the right antibiotic, Joyce felt better within 48 hours than she had in 9 days. What she understood afterward was simple. She had done everything the way she always had. After 70, the rules are different. Now, here's the thing I promised you at the start. What can happen after you feel better that most people are never warned about? The antibiotic works, the parasite clears, and then, sometimes days later, sometimes weeks later, the diarrhea comes back. But it's different this time. It's more watery, more cramping. And the antibiotic you already took won't fix it, because what came back isn't the parasite. It's a separate infection called C. diff, short for Clostridioides difficile, a gut bacteria that can take hold after antibiotics clear out the normal protective bacteria in your gut. The FDA label for Bactrim itself warns that this can happen during treatment or up to 2 months after finishing it. How do you tell the difference? The timing and the feel are different. The original infection comes on fast and explosive. C. diff tends to come back as watery diarrhea with cramping after a period of feeling better. If your diarrhea returns after you've already taken the antibiotic and recovered, don't go back to the Imodium. Go back to your doctor. Tell them exactly when you finished the antibiotic and when the symptoms came back. What I want to be clear about, C. diff is very often treatable when caught early. There's a specific antibiotic for it, different from Bactrim. Early recognition leads to recovery, usually within 1 to 2 weeks of starting the right treatment. This is general health information, not advice for your specific situation. For your own case, speak with the physician who knows your full history. But now you know the difference between managing this at home safely and waiting too long. You know what not to reach for. what to drink, which medications to ask your doctor about holding, and the one sign: not thirst, not dry mouth, but confusion. That means it's time to go to the emergency room. If someone you know has been dealing with stomach illness this summer and they're over 70, a parent, a spouse, a neighbor, share this before they reach for the Imodium. The signs that this has become serious look different after 70, and most people don't find out until they're already in an ambulance.